Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Hypercarbia causes and symptoms of high CO2 in the blood. Hypercapnia describes high carbon dioxide, CO2, levels in the blood above 45 mm Hg. It can happen when there is an overproduction of CO2 or an inability to efficiently clear it from the body. Hypercapnia can be a life-threatening health crisis. /R/N/R/N carbon dioxide is produced naturally in the body during certain cellular processes. It is usually removed during exhalation, but certain medical conditions such as chronic obstructive pulmonary disease, COPD, cystic fibrosis, and neuromuscular diseases can cause it to build up in the blood. /R/N/R/N-Hypercapnia is a condition marked by excessive levels of carbon dioxide in the blood. Carbon dioxide, CO2, is a waste product of respiration. /R/N/R/N as you inhale, air enters your lungs, and oxygen then moves into the blood, which carries it to your body systems. Once you have inhaled oxygen, you exhale carbon dioxide. This process is called gas exchange. /R/N/R/N medical issues arise when not enough oxygen enters the lungs. However, problems can also occur if too little carbon dioxide is exhaled, which causes the body's CO2 levels to spike. /R/N/R/N This state is known as hypercapnia, sometimes called hypercarbia or carbon dioxide retention. /R/N/R/N The terms hypercarbia and hypercapnia both describe conditions in which carbon dioxide levels in the body are elevated. They are often used interchangeably. /R/N/R/N and hypoxemia mean two different things because hypoxemia refers to low levels of oxygen in the blood. It can lead to hypoxia, which describes low oxygen levels in your body tissues and organs. /R/N/R/N Many people are unaware that they have mild hypercapnia. When you consider the common, everyday nature of the symptoms, you might understand why. /R/N/R/N The symptoms of high CO2 levels can include /R/N/R/N when CO2 levels become elevated, special receptors in your brain detect the increased blood level. These receptors send messages to your lungs to make you breathe more deeply and or faster until your CO2 reaches a normal level. /R/N/R/N With severe hypercapnia, though, the symptoms and complications can become life-threatening. /R/N/R/N Hypercapnia affects your blood's pH balance. When you have hypercapnia, your blood becomes too acidic. /R/N/R/N If hypercapnia happens slowly, your kidneys may be able to help restore the normal pH balance. /R/N/R/N Some people experience only mild symptoms including headache and fatigue. When the mechanisms designed to protect this balance in your body no longer work, however, more severe symptoms of difficulty breathing, respiratory failure, seizure, and coma can occur. /R/N/R/N Severe hypercapnia can cause noticeable and distressing effects. Unlike mild hypercapnia, the body is incapable of restoring CO2 balance, which can lead to organ symptoms. /R/N/R/N Severe cases of hypercapnia can lead to respiratory failure and coma if left untreated. Call 911 if you experience any of these symptoms. /R/N/R/N Hypercapnia results from excess CO2 production or reduced CO2 exhalation from the lungs. Some health issues may be at the root of these dynamics, and a number of risk factors may increase the odds of the condition developing. /R/N/R/N It's rare for someone who is healthy to develop severe, also known as medically significant, hypercapnia. But certain types of health issues can trigger the condition. /R/N/R/N Illnesses, infections, and severe trauma can cause an alteration in the body's metabolism, resulting in excess CO2 production. If your breathing can't catch up with your need to exhale CO2 from your body, you can develop an elevated blood CO2 level. /r/n/r/n causes of excess CO2 production include /r/n/r/n lung disease can interfere with CO2 removal. A situation called ventilation/perfusion (VQ) mismatch occurs when you have severe lung damage that prevents the flow of blood and/or air in your lungs. /r/n/r/n the following chronic conditions can cause CO2 gas to build up in the body. /r/n/r/n is a major cause of hypercapnia. But even people with severe or end-stage COPD may not develop hypercapnia. /r/n/r/n neuromuscular diseases such as amyotrophic lateral sclerosis, ALS, and muscular dystrophy can make it a struggle to breathe, resulting in a build-up of blood CO2 levels. /r/n/r/n myasthenia gravis is another neuromuscular cause of hypercapnia. /r/n/r/n conditions that impair your brain's ability to regulate breathing may result in CO2 accumulation in your blood, central hypoventilation. Your respiratory control can be impaired by /r/n/r/n in rare cases. High CO2 blood levels can be due to a genetic condition known as alpha-1 antitrypsin (AAT) deficiency. /r/n/r/n is a protein that is made in the liver and helps to protect the lungs from damage caused by smoking, pollution, and dust. People who are AT deficient are at greater risk for lung diseases that can lead to hypercapnia. /r/n/r/n AT deficiency occurs when a person inherits two mutated AT genosomes from each parent. While it can occur in any ethnicity, it is more common among people of Northern European descent. /r/n/r/n anything that can damage your lungs can put you at risk for hypercapnia. This includes /r/n/r/no. Multiple studies have found no link between face mask use and an increased incidence of hypercapnia. In one study, continuous use of high-quality face masks caused a slight but temporary increase in CO2 levels in healthy adults. However, this rise did not exceed National Institute for Occupational Safety and Health (NIOSH) limits. Additional research studied mask use in people with COPD and found no increased risk for hypercapnia. /r/n/r/n often, the symptoms of mild hypercapnia are simple enough for an experienced healthcare provider to address. They are worth monitoring, particularly if they linger or get worse. /r/n/r/n severe hypercapnia requires a more assertive approach. Efforts usually focus on a search for the underlying cause, and the search begins with a careful history and physical examination. /r/n/r/n you will likely need a blood test that measures your CO2 level. An arterial blood gas, ABG, test measures your blood oxygen, CO2, bicarbonate, and pH. /r/n/r/n typically, blood tests use blood samples taken from a vein. An ABG test requires a sample of blood from your artery. /r/n/r/n you may also need other diagnostic tests. In the meantime, you may require intervention with medication and/or assistance with breathing from a breathing mask or mechanical ventilator. /r/n/r/n hypercapnia is usually diagnosed when CO2 pressure measures at 45 mm Hg, millimeters of mercury, or above. /r/n/r/n aside from blood tests, certain go-to tests include /r/n/r/n treating hypercapnia focuses on improving ventilation so that you can get rid of excess CO2. The type of treatment used depends on the severity of the condition. /r/n/r/n people who have hypercapnia due to a chronic condition tend to have a poorer prognosis than those who do not, even with the same underlying cause. Early diagnosis and effective treatment may contribute to better outcomes. /r/n/r/n hypercapnia can often be prevented by managing the underlying cause. /r/n/r/n if you have a condition that puts you at risk for high CO2 levels, be sure to follow your treatment plan. Take your medications as prescribed, keep your follow-up appointments, and follow your healthcare provider's recommendations for monitoring. /r/n/r/n Lifestyle changes can also help to prevent CO2 levels from getting too high. This includes /r/n/r/n Mild hypercapnia can be hard to spot. Having too much carbon dioxide in the body can cause non-specific symptoms like headache, fatigue, and muscle twitches. Often, it clears up quickly on its own. /r/n/r/n With severe hypercapnia, though, the body can't restore CO2 balance, and the symptoms are more serious. An underlying health condition usually triggers hypercapnia, and the sooner it's identified, the sooner you can get treatment. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.